From group 2, we'll discuss about the couple Atta Aurel who had a miscarriage. There is something trending on YouTube.
What the heck?
Seriously, I don't know.
I really don't know. What the heck is
This is the video of the couple Atta Aurel on YouTube.
What is Alta Aurel?
I heard about oral miscarriage.
What is a miscarriage?
Miscarriage stops pregnancy by itself when you are young before the age of 20 weeks of pregnancy.
Oh, that.
Instead of being serious, let's watch the video. How come you miscarriage?
After passing the grave, maybe.
Young pineapple.
Don't conduct the fetus code.
It's not like that. Rather than you are curious, we better look it up on the internet.
Causes of miscarriage. 1. Chromosomal abnormalities. The risk of miscarriage due to chromosomal abnormalities can reach 70% in the first trimester and 20% in the second trimester. Unsaid parents, this occurs because of an error in the genus of the fetus. During fertilization, the sperm and eggs combine 23 chromosomes to create a very pair. It is a complex process and even small mistakes can lead to genetic or chromosomal abnormalities. 2. Thyroid, either hypothyroidism too low or hyperthyroidism too high. Thyroid disorders can cause infertility problems or cause recurrent miscarriage. The Malpani Infertility Clinic website explains, in cases where a woman's thyroid function is low, the body will try to compensate by producing hormones that can suppress ovulation. 3. Diabetes. Diabetic with uncontrolled insulin dependence can cause increased risk of miscarriage and the risk of birth defect when the patient is in the first trimester of pregnancy. So women with diabetes need to consult a doctor to optimize their sugar control.
It took me a long time to write. 4. Sometimes infection. Infection can lead to miscarriage. This infection can include sexually transmitted infection (STIs). STIs such as gonorrhea can increase the risk of miscarriage and outer pregnancy complications. Other infections, routine infections such as food poisoning caused by listeria can also increase the risk of miscarriage. 5. Hormonal imbalance. Sometimes a woman's body does not produce enough of the hormone progesterone, which is needed to help the uterine lining support the fetus and help the placenta to hold the fetus, because it's actually not very common. 6. Use of drugs, alcohol, and smoking. Some unhealthy lifestyles, such as substance abuse, alcohol consumption during pregnancy, and smoking can cause early miscarriage and miscarriage in the next trimester. Optimizing your health ahead of pregnancy can help reduce the risk of miscarriage. 7. Immunological disorders and chronic diseases. The American College of Obstetricians and Gynecologists believes that certain autoimmune disorders can also cause miscarriage, especially in cases of the recurrent miscarriage. Also, the relationship tends to be complex. The simple understanding is that the body does not urge pregnancy. 8. Obesity or underweight. Obesity can increase the risk of first and subsequent miscarriages. Women with a low body mass index (BMI) before becoming pregnant are also at increased risk of miscarriage.
The
Then how do you deal with issues that you don't have a miscarriage?
Let's look for it again.
How to prevent miscarriage? 1. Consume folic acid. Learn how that consume. 4. Intake folic acid include green vegetables such as sains and kale, nuts as spinach, beans, asparagus, whole wheat bread, cereal, tomato, and avocado. 2. Take B vitamins. Start taking vitamin B every day before you intend to gain pregnant. Continue to consume during pregnancy for the great benefit of 3. Adopting a healthy lifestyle. Moderate to care lifestyle to be healthier. Nowadays, guys are avoiding for factors that are definitely unhealthy for pregnant women are preferring natural miscarriage. For prevent infection, the infected is then patient of the factor can make fetal development not optimal, even if it does not survive the fetus with miscarriage. For that, prevent infection on of which is by regularly washing your hands with soap as often as possible, especially before and after eating. 5. Vaccination is for pregnant women to get vaccinated, one of which is the flu vaccine. Therefore, infectious diseases can affect fetal growth and development. 6. Managing chronic condition. Do you have chronic diseases as diabetes, autoimmune problem, and high blood pressure? We recommend that you call a doctor to prevent unwanted things, include early miscarriage, managing chronic diseases such pneumatic and cup prevent miscarriage. There is thrown out toward I'm tired.
Okay, 7. Have sex. Some sexually transmitted diseases, as known as STDs, can cause pregnancy complications. Therefore, Nuadike said it would be better if married couples check whether they have STDs or not before starting the pregnancy program. If you already pregnant, this STD test as soon as possible. 8. Avoid radiation. Pregnancy as much as possible. Avoid radiation rays and toxic chemicals such as arsenic, lead, formaldehyde, benzene, and ethylene oxide. Unless pregnancy women need a radiation process such as X-ray or CT scan to support medical diagnosis. Certainly, doctors have considered it. 9. Perform maintenance. Better to relative safe sports such as swimming, yoga, and jogging. If you are accustomed to driving, it best if someone asks to be driven first for a while. This is to reduce the risk of fatigue and possible injury. But if you are used to driving car, always use safety belt. Likewise, if you travel by plane, for example, apart from bringing a flight approval letter from the doctor, you need to bring a maternity belt to support your stomach, so your trip can be more comfortable. And do not take any medication. Dizziness, diarrhea, or access can be experienced by pregnant women. To relieve it, sometimes you take drugs that are sold in the market. To avoid unwanted things such as miscarriage, consult your doctor first. And 11. Prevent recurrent miscarriage. If you have previously had miscarriage, your risk of miscarriage increases. Therefore, when you know the cause of miscarriage, it's good for you to remember. For example, you know that a previously miscarriage was caused by an autoimmune response or hormonal imbalance.
Choose the discussion from group 2 if that is an error in the word apologies. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Berarti habis ini